Okay, let's just jump right in. If you're dealing with that nagging leg pain, the kind that's stealing your sleep, your sanity, pretty much everything, you're probably just trying to answer one huge question. What test is finally going to tell me what's going on? Well, that's exactly what we're going to build today. A clear decision ladder, just for that.
And this really gets to the heart of it all, doesn't it? The goal isn't just to get a test, it's to figure out what test will actually change what happens next. That's the whole point. So let's forget all the confusing stuff you find online. We're here for clarity.
But first, a really quick and very important disclaimer. Look, this is for education only. You should always talk to your doctor. And if you have any of these red flag symptoms you see on the screen, I'm talking about severe weakness, new bowel or bladder issues, numbness in that saddle area, please seek urgent medical care right away.
All right, let's get into our first big idea here. We've got to kind of reframe how we think about this leg pain. It's all about seeing a pattern, not just hunting for a diagnosis.
So what even is sciatica? You hear that word all the time. But here's the thing. It's not actually the final diagnosis. Think of it more like a useful label for a pattern of symptoms. That pain, numbness, or tingling that travels down a very specific nerve pathway. It's basically your body telling you, hey, a nerve is probably irritated somewhere along this line. It's the start of the story, not the end.
Now for the main event. X-ray versus MRI. What is the fundamental difference between these two things?
Okay, here is a fantastic analogy that makes this super clear. Think of an X-ray as a flashlight. It's awesome for seeing the bony architecture, things like fractures, alignment, arthritis. It answers bone questions. An MRI, on the other hand, is like a storyboard for a movie. It shows you all the soft tissues, the discs, the nerve roots, the spinal canal. It answers your nerve and soft tissue questions. See? Totally different tools for totally different jobs.
So, of course, this leads to the question that's on everybody's mind. Which one is actually better?
But here's the twist. The key mindset shift we need to make. That is the wrong question to be asking.
The right question, the one that's going to save you so much time and frustration, is this. What are we trying to rule out? I'm telling you, this one question changes everything. It puts you in the driver's seat.
Okay, so with that new, much more powerful question in our heads, let's apply it. When does each test actually make sense? This is all about applying the right tool at the right time.
So check out this decision card. It makes it pretty simple. You'd use an X-ray first if there's been, say, recent trauma or a risk of fracture, or if the main concern is a major bony change. But you'd think about an MRI first, or at least pretty soon, if you're having those classic leg-dominant nerve symptoms, or some objective weakness, or if you and your doctor are actually starting to plan for an intervention, like an injection or surgery.
Here's a great way to think about it. An MRI is most valuable right before you get to a fork in the road. It's a decision-making tool, not just a let's see what's in there tool. Its job is to give you a detailed map right when you have to choose which path to take.
So this is the question to ask yourself right now, honestly. Are you actually at that fork in the road? That MRI becomes an absolutely essential map when you've hit one of these three big decision points. 1. Your leg pain is still disabling you after weeks of trying other things, like physical therapy. 2. You're noticing real worsening weakness, like your foot is dropping or you're tripping more. Or 3. You and your doctor are actively talking about an intervention. If you're not at one of these points yet, an early MRI might just give you more anxiety instead of more clarity. Okay, next up, let's talk about the common traps people fall into. This is so crucial because you have to protect yourself from the problem of too much information.
Here's the big secret. An MRI can sometimes be a little too honest. It can find all sorts of things that have absolutely nothing to do with the pain you're feeling right now. Things like disc bulges, they are incredibly common, even in people who have zero symptoms. It's like finding a wrinkle on page 50 of a book. It doesn't necessarily explain the plot twist on page 200.
And that is why this term is so important. Clinical correlation. This is the absolutely essential step where your doctor matches an imaging finding, that's the clue from the MRI, to your specific symptom map and what they find on your physical exam. The MRI report is a clue, not the verdict. Your personal story is the real anchor here.
So, to avoid these traps, let's just nail down these 4 common mistakes. 1. Expecting an X-ray to show a pinched nerve. It just can't do that. 2. Treating that MRI report like it's the final word. It's not. 3. Skipping a real, hands-on neurologic exam before getting the scan. And 4, maybe the most important of all, not asking, what will we actually do differently based on these results? Seriously, That question right there is your superpower.
All right, let's bring this all together. Let's build your high-signal action plan. This is how you go from feeling totally confused to having real clarity. I want you to take this checklist to your next doctor's appointment. Ask these questions. What are we trying to rule out here? What specific findings on my exam make an MRI necessary right now? If the scan shows X, what's our game plan? And don't forget the practical stuff. What do you need to get this authorized by my insurance? This is how you have a truly productive conversation.
And here is something you can do today, right now, in literally 60 seconds. Create your symptom map. Just ask yourself, where exactly does the pain travel? What two things reliably make it worse? Can you give a real-world example of weakness, like I'm tripping on the stairs? And maybe most importantly, what's the trend? Compared to last week, are you better, worse, or the same? Being a clear narrator of your own story is the most powerful tool you have.
And this brings us to the single most important takeaway, the one question that cuts through all the noise. Ask yourself this, and ask your doctor, will getting an image change my treatment this month? If the answer is yes, you've got a great reason to get the test. If the answer is no, well, your energy might be better spent on other things right now. And that question, my friends, is your calm, clear, high-signal plan.